Hi, I'm Kay Jansen from the University of Wisconsin-Milwaukee College of Nursing. I'm the undergraduate program director and a clinical professor at UWM.
Hi, I'm Lisa Milbauer, and I am a clinical associate professor and the director of the RN-to-BSN and completion programs at UW-Milwaukee's College of Nursing. Our programs consist of one curriculum delivered in 3 modes: a face-to-face, an online, and a competency-based option called the UW Flexible Option. One of the benefits of partnering with the UW Flex system has been professional development that has been provided for our faculty. Faculty workshops have helped us to look deeper into assessing student learning. We explored how we could incorporate evidence-based rubrics developed by the American Association of Colleges and Universities, better known as AAC&U. We loved the rigor that went into creating these rubrics and how well the AAC&U critical thinking rubrics aligned with our professional nursing organizations' definitions of critical thinking and clinical judgment. We also realized that the value rubrics provide a practical tool upon which to define and build those skills. Kay will explain the process that helped us to reconsider how we assess critical thinking skills and how we evaluate the impact of those changes.
So we started with a nursing informatics course that I had been teaching for several years. We realized that we needed to explicitly ask students to demonstrate critical thinking. One step was to precisely define, based on the value rubric, the critical thinking elements within the assignment prompts. Another step was to align key elements of the grading and value rubrics to facilitate valid assessment. We identified strategies for adapting the value rubric to authentically evaluate our students' work. We then mapped the value rubric to the grading rubric to see what we needed to add or adapt. We also clarified our assignment prompts and aligned proficiency descriptions with the value rubric.
These changes really helped our students in 2 ways. It helped them to understand what we were asking them to do and what they needed to demonstrate in order to meet the desired level of competency or proficiency. Kay, you saw some pretty profound differences in students' work after that, didn't you?
Absolutely. The changes were really powerful. A significant number of the student work samples were better, and for the students who did really well, their assessments were much better than anything I had seen previously. The students had clearly looked at the rubrics and understood what they were expected to demonstrate once we were explicit. For one assessment, we realized that we had been evaluating context without having asked for that in the prompts or having described this expectation in our grading rubric. We had to reframe this assessment to ask students to talk about the different situations in which they could apply the knowledge and skills they were learning. After that change, we could see notable differences in the students' work.
I think we'd agree that the rewards are great and the process of incorporating higher level learning skills into an assignment is challenging.
Absolutely, yes. One of the biggest challenges is to be intentional and explicit about assessing competencies such as critical thinking, and that's very hard to do. What helps is using the AAC&U value rubrics. These rubrics provide a standard that can be used to construct both the assessment and the grading rubric using explicit criteria and proficiency descriptions that meet the intent of the assessment. This really helps students learn. It also increases the transparency of assessment criteria, and that means students know what we're looking for. This application of the value rubrics was not something we'd seen before in the nursing field.
That's true. When we presented our work at a recent professional nursing education conference, there was a lot of interest from faculty and other nursing programs around the country. And one of the first things they would say is, we already use rubrics. And when we asked, but have you seen the AAC&U value rubrics, very few had seen them. They were surprised to see how the value rubrics could really be used to create assessments and grading rubrics for the nursing profession, and it was great to be able to disseminate a new tool for assessing higher level learning outcomes to our colleagues. Kay, how has our work with the critical thinking value rubric impacted you personally?
I knew what critical thinking was before the workshops, but to have it operationalized in such a clear way really helped. The critical thinking value rubric is now etched into my brain and changes very much the way I teach. I think about it not just when developing assessments, but when I ask students questions in a classroom setting. This has taken me to a different place in terms of looking at student proficiency of essential competencies like critical thinking. I'm now considering how we could embed competencies like critical thinking and integrated learning in multiple assessments that would allow us to assess changes in proficiency as students progress through the program.
As you can see, we're excited about applying the AAC&U value rubrics in nursing, and this is just a beginning for us. We're looking forward to building on this work. Thank you for your interest.